In a developing story, medical debt affects more than 100 million Americans and is the #1 cause of bankruptcy. Those numbers come in from the Scheinman Institute at Cornell University. Michigan leaders and the nonprofit Undue Medical Debt are working to tackle that issue in our states. Mid-MichiganNow's Andrea Flores tells us how the efforts will help.
Governor Gretchen Whitmer secured in the state budget $144 million that will provide relief to more than 200,000 Michiganders. Medical debt is a burden that can last a lifetime. Governor Gretchen Whitmer says working with nonprofits like Undue Medical Debt and other organizations is an important way to provide some relief, especially in the wake of federal cuts.
We also know that medical debt, coupled with the recent federal actions about cutting Medicaid and cutting access for health care, is only going to make it harder for Michiganders to get the care that they need.
Lieutenant Governor Garland Gilchrist echoes that concern.
500,000 people who could lose their health care. 30% of Michiganders get their insurance from Medicaid.
State Senator Sarah Anthony says the stakes couldn't be higher.
No one should have to choose between paying their rent and getting a surgery. Our Michigan residents deserve relief.
Allison Sesso with Undue Medical Debt says this effort isn't just about one-time help. It's about changing how we think about healthcare costs.
The #1 predictor of whether or not you end up in medical debt is whether or not you get sick. It is not related to your insurance status or anything else. That is a sad reality.
Governor Whitmer adds she spoke with both Republicans and Democrats to create this bipartisan legislation to further reduce medical debt, and that effort is only the beginning. In the studio, Andrea Flores, Mid-Michigan Now.